Okay, hello everybody. It's Monika Davidovich from Wolf Summit, and today I am hosting an interview with Helene Chenevaux. Is that the right pronunciation of your
Yes,
last
very
name?
good.
I'm sorry, it's always confusing, and even yesterday during the conference I have mispronounced something. But on the other hand, if I asked somebody to pronounce mine, maybe they wouldn't be. They're very proficient at that.
I don't want
Okay.
to try, please. Monica's fine, but then
Okay,
afterwards,
Monica, let's stay with that. Okay, so Helene is a startup founder, and yesterday we had this 100 Wolves pitching contest. She took part in that with her startup RAMPmedical. And she made it to the final, so congratulations for that. And I'm really happy to be, talking to you here today. So I think Helene would tell you more about RAMPmedical. What I can tell you as an introduction is that it's a startup that helps doctors to make a more accurate and more precise diagnosis. So maybe you should tell something more about it and, talk about the startup in details. How does it work? What is it?
It's similar to what you said. So I know most decision supports are about the diagnosis, but actually we focus on the treatment decision. So after the diagnosis has been made, and I think that's how we differentiate regarding the market the most. Like there are very, very few that focus on the treatment decision, and that's what we have been doing.
So, like from the practical standpoint, what does it change for a doctor, and what does it change for a patient? Yeah. So, what's the practical outcome?
So the problem is that currently the doctor makes a diagnosis and then a treatment decision, and it's based on he went to a conference that probably has been sponsored by pharma. So he learned things about the drugs that were promoted on a conference where, of course, that's also companies. They promote the products that bring the most value or have the highest revenue expectations. So there's a very big bias. And I've been working in a pharma company, or in pharma and a medtech company. So I know that you just have to sell your product too there. So there's already a very big bias on the knowledge that you acquire. And despite that, there is so much more knowledge out there that's happening in research, but nobody's promoting. Like when there's no value, let's say, about diets or prevention or whatever, like when you cannot earn money with it, nobody will take the time to promote it. So the treatment that you receive has probably a very big bias towards what is the most money-making therapy in the market, even though doctors are aware of that and try to pay attention to that, but it's impossible to check all that. There's alone in diabetology over 40,000 publications every year. So it's impossible. Nobody can read that.
Absolutely impossible.
Yeah. And this makes not only for a patient that probably he doesn't reach what would actually be best, but just like with big bias towards what's more valuable for a company that has somewhere in the value chain earns a lot of money with that. But despite that, even though if there wasn't this bias, it's so complicated to match your patient history. Like I'm 31 years old, so I had a surgery at 14 and I had an appendicitis, but the appendix wasn't taken out. Like there are so many details of my patient history, and I'm not so old. And when you look at someone at maybe 60 years old, there's so much details of the patient history, allergies, and whatever. And it's very difficult to take all this and adapt all the treatment possibilities, all this new knowledge with all this complicated patient history. And so it took us 4 years to make, or 3.5 years to make a first version of a concept, how this can really work, that we could test this and we could actually improve it. So we tested, there are very few studies, it's a sensitive topic to talk about mistakes in treatment decisions, because it's actually committing to a crime. Somehow, you somehow made a mistake treating a patient. So we made a little study about that. And we found that there are actually a lot of mistakes that are being performed even by specialists. And we found also that our software could actually help improve this a lot. And we improved this since our software. And so it has become really good. And now we want to spread it everywhere in the world.
Okay. So how does a patient benefit from that? Like, what's like the, if you were to sum up in one sentence, because obviously you address your product to doctors, to clinics, to hospitals, but like the end user, the end person who benefits from that is a patient. So it's you, me, anyone who is watching. So how do they actually benefit from that solution?
So there's according to the World Health Organization, when you go to see a doctor, a 1 in 10 probability, so 10% is that you receive a wrong treatment. So this cannot happen with our software.
Okay.
So
This
you can be sure to receive the right treatment. And before, it's so dangerous to receive the right treatment when I don't know if you're aware, but a lot of elderly, they have kidney problems. And a lot of these kidney problems are a result of wrong treatments. So you get a first disease, then a second disease, let's say diabetes.
And it just goes like a domino.
And then you get treatments that don't match one another. They are somehow suboptimal, too much high side effects or something. And then you get really, really sick very fast and also expensive for the system. So for the healthcare system, for the insurances, like someone with a damaged kidney, that's like not only for the patient going to a dialysis regularly, but for the health insurance, it's incredibly expensive. It's for you, even if you don't have the disease, I don't know, but probably you don't have statistically, you don't have a kidney damage. Then also you pay into the insurance, your health insurance.
Of course, because all of us, we just pay for that.
Yes.
So okay. So you minimize also your product also minimizes that cost for everybody. Yeah, not even for the patient who is treated at the moment. Okay, and why did you even decide to work on such solution? Okay, you saw that you noticed the problem, but what are the reasons that you decided to set up a startup and just do what you're doing?
I got, so when I worked in pharma or medtech, I got well along with the clients who were doctors, before I worked in a clinic. So that's where I came from. And then it worked quite well for me. I was quite successful, and I had accumulated some money to be able to found a company. Also I had accumulated some more money because I had a baby, just I think 1 year before founding the company. And in German, you have, I think, 8 weeks where you are not allowed to work. And I'm just a person who works all the time.
Okay.
So then I really wasn't allowed, and I started investing myself into 2 healthcare companies, like at the stock market. So and I had a little more money coming out of that.
Okay, so you used that time wisely.
Yeah, so there were 2 intense times on the stock market. So I had some money, and I knew the problem, and I knew, like, when I talked to the doctors, there were some situations in a pharma company you're not allowed to talk about certain things like off-label use. That's when you promote a drug, and there are studies about that it's also helpful for other diseases, but it isn't certified for that. So you're not allowed to talk about that. And I got these questions a lot from doctors, and I thought, like, I'm really not allowed to talk about that. What do I do? Like, it's for a super sick patient. Like like I work in marketing. The doctor calls me and asks, like, I have a super sick patient. I heard this drug also helps for this patient. And
you couldn't
I'm not
say
allowed
yes.
to talk about it. So then I knew my people, so the doctors knew what they are doing in their everyday life. And I called another doctor from Munich, from Max Planck Institute.
Oh, I know. I lived in Munich. I live nearby.
So I talked to him again about that, because he used it for these other patients all the time. and then I put them in contact, that was the solution. But I thought that's so weird. Like, I have this knowledge, I have a medical, like in Germany you need some sort of medical degree to work in pharma. I have this medical knowledge, I know the market, I know how they work, I could help them so well. I don't know yet how
you couldn't
would
but
all
you
work.
couldn't
I
spread
have the money, so I quit. And then then I
you
did that.
decided to jump into that.
Yeah, and I
Okay.
think I was always like that. When I think it's the right thing to do, like
Uh-huh.
I started and then I finish it, and then
So it's also like a sense of a mission. It's not just
yes,
a business decision, it's some calling. Yeah.
yes.
Okay, and how did you manage? You said that you started this business when you had a little baby. So how
Yeah.
did you manage to do that? How was it? For a lot of parents, probably some of them are watching us right now. Even working at home with children who are already grown enough to occupy themselves with something is difficult. So how did you manage, like, building the foundation for the business when you had a little baby?
Well, I don't know, like my children, they are quite well behaved, so I think it was fine, like in Germany,
Okay.
I don't know how it's elsewhere, but in Germany you just don't bring it up all the time, why are you late now or something, where are you, it looks so homey, aren't you in the office?
Okay.
I know, like there's, what's the noise? Oh, it's outside, something like it's not super appropriate in Germany to have children around. But I grew up like that. Like I think I was so involved in the clinic of my father because I played there when I was small. So
Okay, so for you it was a natural thing that children can be a part of your work life.
Yes, like now when I work, sometimes my children, they ask me what am I doing or something when I work late or something, and then they just learn how to copy paste something, or I don't know, they participate a little bit in the database or something.
Yeah, so maybe they will follow your example and also get involved into some,
Well,
medical.
I hope, but I think I started pressuring them already, and now they don't want to do it at all.
Oh, that's
They want to
interesting.
do
And
their
were
own
were
thing.
you pressured by your parents to pursue a career connected to the medical field? Or was
Well,
it just your decision, like completely?
well, it was kind of either I become a doctor or a housewife.
Okay, that was the choice that they gave you.
Not openly said. Well, there was openly said. I don't know how openly. It's kind of clear you become a doctor. Everything else is a hobby. Um,
Okay.
but then in the end, like as doctors often, I don't know, not all. Like yesterday I talked to a doctor who was like top on business questions. But like it's often, I think, particularly from the Eastern Germany, like business thinking wasn't a thing. So it kind of, I had it always in my head. Like I was always thinking about numbers and statistics and everything. And I saw that in my family, they needed a lot of help, like with a clinic that was a mess.
So they were just expert doctors, but not experts business people.
Yeah,
So they needed someone to just do the research, the business research for them, and then try to apply.
Managing whatever. Like it's like you learn medicine stuff, and you don't learn management really, and you never have the time to take care of that. So you do it like intuitively, and that's when the clinic, there were like 20 employees or something. Like with 20 employees, like it's already, I noticed with 2-3 employees, it starts going beyond, you can just use your intuition to solve everything correctly. Like I don't know how you managed when you had a company, or like I constantly take law courses, and I don't know, like I took business administration courses, economics courses, medical courses, and statistics courses. Like you need to know so much things, and when you have a clinic and you just studied medicine, like you're missing a little bit of knowledge to manage all that, I think.
Yeah,
Like
but on the other hand, when you have
everybody.
a clinic, you're just focused on treating people. Yeah, so this is what occupies your head and your time, and probably that's why they didn't have enough time to work on that. Okay, and Well, this is the thing that we spoke about a little bit before we went live. Is it difficult to start a business in Germany?
Depends on the form of the company, but I think to start it with GmbH, that's our form of company, like it's a
Like the limit.
Kapitalgesellschaft. Yeah, it's like
yeah, so it's like
limited.
the limited. Yeah.
Yeah, and it takes some weeks. Still takes some weeks.
But is it a lot of paperwork? Are there any
Yeah.
fees that you have to? Are there any fees that you have to pay upfront, or?
Well, you have to pay a notary's office. I think it cost about 800 euros or something. Yeah.
Okay. So there is some effort, but is it encouraged? I don't know, by the government, maybe some programs to start a business. Is it like, when you ask young people, oh, would you like to start a business? They say, oh yeah, sure, or no, I'd rather have a 9-to-5 job.
There are a bunch of funds from the government. So we kind of fell out a little bit because we have a very scientific project. And what I see in Berlin, like the scientific projects either are spin-offs of the university here, or it's just not in Berlin. Like I don't know any project that is as scientific as ours, not coming from the university here. And we were kind of out of a lot of public funds. Also, it wasn't necessary. I was a little spoiled from pharma. Like this is a very comfortable life, in pharma. Like you have always, like you're not thinking about any public funds. I think like it's not necessary, not worth the work, and then
okay.
So that's also why we are a lot active in Switzerland, because there are funds for non-university scientific projects. But then if you don't do such a scientific project, we really had a very long development time before bringing out the first product. I think it's fine. There are a lot of funds. Like there's something like when you come right out of university for, I don't know, 2 years afterwards, you get 1 year of salary for your company or something, like for everybody or something. And it's really good. Like, yeah, really. But the bureaucracy in Germany is not to underestimate, definitely. Yeah.
And how about the social perception of a founder, of an entrepreneur? Well, is it admired by people, or is it more like, somebody is doing business, so they are either from a rich family or they're just, lying to everyone and stealing? What's the social perception of a founder?
I think when I think about like most people in general in Germany, I think it's kind like most are a little bit too conservative in thinking that it is a reasonable thing to do. But in Berlin, I think it's fine. Like in Berlin, it's not like everywhere in Germany, like people are much more open-minded. I don't think that people assume really that you do it because of a lot of family money, because there isn't really family money in Berlin. Like at least when you're from Berlin, like there wasn't, in the East, there wasn't, it wasn't the possibility to have family money. I think people kind of have a misperception a little bit. Like they think one thing is they think it's very risky and like not unlikely that you can just have a company. You work in a company, but you cannot have a company. But I think in comparison, it's really fine. Like we are also in France, and like in France, it's just, I don't know, most experience that I had in France is like, you cannot have a company. Like, what are you doing? Like, oh my God. And then when I have a company like there, I get this weird, super high respect from the people that are my friends, like some that I studied with, like, wow, you are a head of a company now. I'm still the same person, really. But it's funny. I think it's fine. I think you're really fine in Berlin with a company. Like you're not edged out or something.
Okay. And sometimes even admired by friends. Okay, and another thing that I spoke to you about on the backstage is that the portrayal of female founders in mass media and in, I don't know, the films, TV series, that, usually A woman who has a startup is somebody who bakes cupcakes after her, I don't know, waitressing job, or it's a mom on maternity leave who decided to just earn some extra money doing some online business, or it's something connected to fashion, or usually it's just a woman who helps her boyfriend or husband doing his startup. And and then I come to 100 Wolves pitching contest, and I see so many female founders. And we shouldn't actually divide if it's a female founder or founder of male founder, but still for some reason a lot of women are, I don't know, maybe a little bit scared of entering the business, and it's still, especially the tech business, is still male dominated. Why do you think? Why do you think it's that?
I don't know. I wonder, is it actually like I get a lot, Jacques, my co-founder, like he's really, really great scientist, and he has some reputation. Like there's this Marie Curie fellowship from the European Union that only very few people get, and he got it twice. Like I never met anyone who got that twice. And what he does in science is really good. But I myself, I also know how to code, and I did a part of the software that also a part of the IP that was also my creation. I'm the CEO, but like we.
Oh, okay, so you're like a Renaissance person. Yeah. Is there anything you don't know how to do? Because during the pitching contest, you said that you do like the business developments and the marketing part here. Yes. So and the coding and everything. So
well, that was really interesting. It's like project. Like I think we go on like a little bit project by project. There was the software to finish. And we do a lot of things together. Also, we think through things together from the different perspectives. Also, we are from different countries, and I think this is like this diversity is just. I think this is what made it so great. But as you like talking about female founders, like I get a lot. Like I don't get some, like I didn't have the feeling really to be discriminated or something. Like I'm really bad at fashion. I always have to ask someone what to do with my clothes or my hair or whatever. But then at the other point, I got a lot of comments, like since we get more attention also since our product is out, that I said who did what of this product, and I did one part, which is the relational database. The initial design is like 2/3 of this database. I designed it myself. I learned how to design these databases, and then I did it myself. And this is like others did other things, but that's just a part that I did. And when I tell that to investors or innovation managers or whoever, and they look at me.
Oh, was that really you? Who did
Jacques, Jacques is my co-founder. Jacques, you're the genius, very good scientist, Yeah, that's weird. No, you didn't do the database. Like, so really? That's why I asked, are there so few women in tech, or is it just that when they say that they did something technological, like people just ignore that? Okay, like what was that? No, it's the men who did it, sometimes. I don't know. I don't mind so much. In the end, it had no effect. Like, when it came up more, or I got more of this, like I don't know, more power to women or all this movement, I started thinking about it, and I get it. Like it's coming a lot. It's coming a lot. Like there are a lot of comments constantly. I'm not discouraged by that, but I get how people can be discouraged by that. Like when you called me this morning, yesterday or something, and you said, you will fill in for the interview. And I had like something that I had yesterday, the same thing. Like I just keep like paying attention to that. And you said, I fill in, but don't worry, I know how to do that.
But it wasn't because it was me who said that, but it wasn't like just because originally Michael was supposed to do it and I as a female, I don't know, but it was more like I'm not just a random person who will do it, that I've already done it before. But it wasn't a gender thing that I wanted to mention.
Yes, I paid particularly attention to that. Like I don't pay attention all the time, but there's just some sign, and I get that yesterday during the pitch, and I had some discussions with people, And I got that too, that I was put in the position where I had to say, I know how to do that, you know.
Okay. And is it because you thought, but do you think it was just because you are a woman, you had to confirm, I know how to do it?
Yes, I do.
And this is horrible. And maybe we do it subconsciously, because I've never heard a man saying, a male founder saying, oh, I know how to do it.
Yeah, and
so maybe we do it subconsciously. Maybe somehow we are conditioned to justify our presence in some fields. And for example, in Poland, we had that foundation called Perspektywy, and they encourage young women to pursue careers in the tech field. Yesterday, we also screened a short film about their program. It's called She's Innovation. So they mentored some women who had ideas for startups, and now during the COVID-19 pandemic, they helped them to actually start a company that might probably change the world. And it's interesting that, such programs are needed, that women still need encouragement. And it's I think it's the cultural bias or some cultural conditioning, and also the thing that you mentioned, that we subconsciously try to justify that I know how to do it. So but hopefully, because I see a lot of female founders pitching, and they're great, they have amazing ideas, they're really talented. So the more of them, the more normalized it will be. And I think we'll stop saying that, I know how to do it, because it will be obvious. So it's great that we had you on stage and other female founders, but also all of the founders, because I'm very proud of all of the startups that pitched today. And so congratulations once again for making it to the finals. I hope, somehow it will help you to gain more exposure. And most of the startups we spoke to, after pitching, they get some investors contacting them. So it's always a good opportunity. So fingers crossed for further developments. What are the plans for the nearest future for the RAMPmedical?
You ask what are the plans? Okay,
the plans. So so like for the next months, what are the plans?
So we want to get some traction in different markets, like also Poland. So if there's anyone listening who wants to integrate with us, that would be really good. I'm always there. Write me on LinkedIn or wherever. And also in other markets, like we want to spread our software as much as possible to help as many people as possible. And I would be really happy if we could advance this very fast in the future. And also at the end of the year, we want to have a funding round again. So I talk already with a lot of investors. So I think that's quite a fine by then.
So it's very promising. Okay, so once again, fingers crossed. Congratulations for yesterday and making it to the finals, and keep us informed about every success and milestone. We'll be very happy to share it with our community. Thank you very much for this talk. It was a pleasure. Thanks a lot.